I'm Lisa Fletcher for Spotlight on America. Happening this week, critical court cases about toxins in baby food that will impact federal cases for thousands of families. A judge will decide whether experts who say they have the science to connect heavy metals to autism will be allowed to testify. This as the FDA faces deadlines for new guidelines for toxins in baby food.
There's few things that is more disgusting than knowingly letting babies eat poison. And that's what they did.
Strong words from attorney Brent Wisner, but he is setting out to prove it, revealing new evidence that advances a story we've been tracking for years. Dangerously high levels of lead, arsenic, mercury, and cadmium in baby food sold in the U.S., a reality he argues caused children to develop autism.
These companies knew internally that they had staggeringly high levels of lead and arsenic and mercury and cadmium in it, and yet they didn't tell consumers.
For 5 years, we've been investigating what companies knew versus what they made public.
House Bill 97, Senate Bill 723, Rudy's Law.
And in the wake of our investigations, states passed laws mandating testing and disclosure of heavy metals.
They've really made strides in fixing the problem because we've brought it to light, because reporting of what you've done, what we've been doing in the lawsuits, and the absolute absurdity of these companies saying we're here to support the development of children when they know that there's literal poison in it.
Despite improvements, Wisner says two major problems remain. There are still no federal laws that set safe, uniform standards for baby food contaminants. And despite years of promises, the FDA has yet to set limits on the presence of known neurotoxins, arsenic and cadmium.
If their mission is to truly protect children's health, and we're talking about a few-year window when babies are consuming this, is a very vulnerable window. There are generations essentially going by who are not protected.
The FDA pledged to set those limits 4 years ago, but ignored its own deadline.
My number one goal is healthier food for children.
New FDA Commissioner Dr. Marty McCary says those days are over.
The FDA, prior to your taking it over, has pushed those deadlines back multiple times. It's on the clock to establish levels for cadmium and arsenic this year. Is that on track?
We have to deliver. We can't keep kicking the can down the road. This is a huge priority.
The FDA has had some pretty big failures.
Yes.
Baby food, lead in children's applesauce, infant formula, and the rap is that this agency is captured by industry.
It has been captured by industry.
You've promised radical transparency. How does that address this very cozy relationship that haunts this agency with industry?
Look, we have amazing scientists here at the FDA, and some of them have been demoralized in periods in the agency's past when it's been captured by the same industry we are supposed to regulate.
McCary says he's drawing bright lines between his staff and the multi-billion-dollar food business.
We are energizing people here around the idea that you do what's right regardless of the corporate interests and lobbyists. And so we're doing things that have only been talked about here in the past.
What do you have to see to believe what the FDA commissioner is saying he's going to do?
I'd like to see the commissioner actually take action on arsenic and mercury and cadmium and set standards not based on, well, what can the market handle, but on what we think is actually a meaningful step in protecting children's health.
Wisner's firm represents about 7,000 families seeking accountability for years of alleged inaction. We're keeping a close eye on that hearing, and we will keep you posted. For Spotlight on America, I'm Lisa Fletcher.